Hello everyone, today's presentation will be on croup. We are Group 239. Group members are Yuju Chen, Keigi Liang, James Pekin, Ilham Adani, Cassandra Beverly, and Anne Marie. What is croup? Croup is a common respiratory disease. It occurs in children from 6 months to 6 years old. According to Wright and Bush, it affects 5% of children, and the peak incident age is between 1 and 2 years old. It usually occurs in late autumn and early winter. Symptoms tend to be more severe at night. Croup is commonly caused by viruses such as influenza and parainfluenza type 1 and type 3. Croup also influences upper airway structures. What are the symptoms of croup? Symptoms include a barking cough, a serious inspiratory stridor, and respiratory distress that attribute to edema and inflammation of the larynx, trachea, and vocal cords. Mild symptoms can be managed at home, and hospital's observations can be done when symptoms get more severe. Where's possible outcomes if left untreated? The most severe forms of croup can lead to paradoxical breathing. This is when the rib chest wall moves out on expiration and in on inspiration. Consequently, the patient becomes hypoxic and fatigued. The patient will unfortunately die due to the respiratory failure. This worst case scenario is, however, extremely rare. Best case scenario. The majority of cases are self-limiting, with a systemic review finding that half of all cases are resolved within the first day and 80% by day 2. No obvious distinction between the cost of treatment had been identified. However, mild croup could normally be managed at home, and otherwise, admission to the hospital is advised. Most expensive treatment. Corticosteroids such as dexamethasone is the most common treatment given to children who administrate to hospital regardless of their croup severity. Dexamethasone has been proved to be effective in reducing the symptoms of viral croup. Oral dexamethasone indicates a faster symptom relief within 6 hours compared to administered intramuscularly. Children with the symptom of varicella or untreated tuberculosis should avoid the usage of dexamethasone as it could accelerate the existing illness. In addition, the effect of corticosteroids should also be carefully observed, especially when treating children who have diabetes or children who have underlying immunocompromised state. Nebulized budesonide is an alternative treatment for children who cannot tolerate oral dexamethasone. Least expensive treatment. Cool mist therapy is a common practice and it is comparatively cheap compared to medication. Steam inhalation is often administered to children at home setting by simply running hot water in the bathroom. On the other hand, humidified air could be carried out in hospital through face mask. However, cool mist therapy has not yet been proved to have any improvement in croup. Moreover, several cases have shown the disadvantage of inhaling steam from hot water as some children got severe burns during the therapy. Which treatment is recommended? The relative more expensive treatment should be recommended as it has been proved to be effective in reducing the symptoms of croup within 6 hours. In addition, records show fewer hospital revisits after the administration of dexamethasone as well as a reduction in the length of stay in the emergency department. The least expensive treatment is not recommended as there is a potential risk of damaging the child's airways even more. Furthermore, although cool mist therapy is considerably cheaper, it is not supported by scientific evidence. Suggested health professionals. Hospital staff and doctors are the main professionals to seek when a child's case of croup gets severe and can no longer be managed at home. Doctors generally keep a child in the hospital once diagnosed with severe croup, so there is ongoing care and observation while the child recovers. A doctor or pediatrician can also prescribe medicine, like steroids, or to keep the croup at bay and stop it from becoming deadly. In conclusion, croup is a common respiratory disease that occurs in children who are between 6 months to 6 years old. The relative more expensive treatment should be recommended as it is more effective. Overall, croup is a manageable and curable disease.